All right, thank you so much for staying with Daybreak. Dr. Alfred Mutua, Machakos Governor, is with us. Kimani Wamatangi, Senator Kiambu, is also with us. And Moses Masika, a virologist, is also with us. We're talking about the COVID-19 measures that are now being put in place. Let me bring in Dr. Mutua on this. And Dr. Mutua, there's a question here from Wambia Moses Mugambi on Twitter. He's saying that how is the governor blaming only DP Ruto, yet we know all politicians have been engaging citizens without masks?
I think I'm not just blaming DP Ruto. I'm just saying that he's the one who's been going out there, meeting people face to face without wearing a mask. President Uhuru Kenyatta came out yesterday and said he's also guilty as charged. Raila Odinga, myself, other leaders. But you see, you've not seen President Uhuru Kenyatta on a face-to-face shaking people's hands. You've not seen Raila Odinga, you've not seen Alfred Mutua shaking hands. You've not seen us talking to women face-to-face without wearing masks. If we are not wearing masks, it's because either you're on top of a car, or which is you have 2-3 meters away from people, or you're on a stage with people far away from you, but not sitting next to people in a church, not wearing masks. Not, you know what I mean? So I mean, it's a matter of responsibility. It's what it is. It's a fact that is out there. So we are not just mentioning William Ruto for the sake of mentioning him. He's been entirely reckless, to say the least. I mean, it's shocking. And as I said earlier on, you don't, as a leader, for heaven's sake, with a disease that is killing people in this country, what message are you sending to the young people around the country when you, as a top leader, you go shaking hands? You're not wearing masks. Here we've been told, don't shake hands, wash your hands. You get out of a car, you don't even sanitize, you're not wearing a mask, you go shaking hands, you enter a building, you sit down, you start singing, and that's captured on TV. It's right there for the whole world to see. I mean, what type of reckless life is that? Whereas the rest of us, you get out of a building, you sanitize, you wash your hands, you wear a mask, you shake hands. The only time you remove your mask is maybe if you're far away and you're speaking on a microphone. So it's what it is. So it's not just attacking him. He has been reckless. And I wonder how many people, and then I ask myself, maybe Dr. Masika can say this, why does he have that confidence? Maybe he feels he's already gotten COVID. He did not tell us. And so he feels he's immune to COVID. He has nothing to worry about. Or why is he doing it? Does he feel invincible, that he cannot get COVID while others can get COVID and die? So maybe, Doctor, you can explain to us why is he that confident walking around in crowds without wearing a mask? I am not. I wear a mask all the time. I don't want to get COVID. I have not gotten COVID, knock on wood.
All right.
So, I'm being very careful.
I'm sure Dr. Masika would not like to get into the political sides of things. But Dr. let me ask you, can you confidently say that the health systems can handle the current upsurge of COVID-19? Because it seems it's not going to go anywhere.
Yes, as I get into that, I will safely comment on the governor's political view. But my point is this, that I welcome the sensible turnaround that we've seen in politicians, that we accept that we've been making mistakes by bringing crowds together and that we are pulling back from that. It's important to know that in all the countries where politicians have taken a posture of ignoring COVID, they've had to pay a price. And short of Tanzania, where we have no data, and you can see even the transparency is a question, we do not want our politicians and top leadership to behave as if there's no COVID, because that always filters down to the citizen, and it is not a good effect. As to whether one has been infected or not, you are still not immune, because we know in many cases the immunity does not last for long. So even if you're infected, you should still take care, because you could be reinfected, maybe, and we do not know whether you will be your outcome if you are infected. The issue as to health systems being ready is a yes or no. We are not where we were in March when this COVID struck. Many counties have made very good strides. We have seen an increase in the investment in terms of bed capacity, hospital infrastructure, and what have you. But we've so far managed to stay afloat because we do not flood these hospitals with crazy numbers. We've had numbers that are manageable. In a way, we managed to flatten the curve. That way, we were having an increase that was manageable. But if we keep the trend that we are seeing now, we could see a flooding of the hospitals such that we will not have enough capacity to take care of the sick if we do not address the current increase. And that's why we need to have a push towards flattening the curve again, so that as we ride the second wave, we do not have too many numbers that the hospitals are overwhelmed. Because if that happens, then the number of deaths will increase because there will be not enough capacity to treat the people who are sick. But I think we are better off than we were. It's just that right now we cannot say we are ready completely because the numbers are increasing. And if they continue increasing at the same pace, then certainly many hospitals will be flooded and they will not be able to handle the challenge.
So, Dr. Masika, how does this play out? Are we going to look waiting for herd immunity, or what happens from here? Because there's still Kenyans who are wondering what's going to happen.
Waiting for herd immunity is I would say, a fool's game, because herd immunity is usually achieved best using a vaccine. And what herd immunity is in this case is that you have enough people in the population protected. For COVID, we're estimating about 60%, that if one person is sick, they are not likely to come across another person who they can infect because the people around them are already immune. That is really herd immunity. And the best way to achieve this is through a vaccine. If you are to do this through infection, it means you're going to infect 60% of Kenyans. If at the rate that we are losing people now, 2% or 2 people in 100, it means you're going to lose millions of people if we keep that rate. And it's likely to get worse because the hospitals will be overwhelmed. So we do not want to develop herd immunity through infection. And even in a recent study by KEMRI, we saw that this is less, about 10-15% in the people they studied have been exposed to the virus. So it means we cannot achieve herd immunity through infection. But the good news is that, well, the speed of developing a vaccine, this for COVID has been unprecedented. Previously, it would take an average of 10 years to develop a vaccine. Right now, there are vaccines that are being tested within a year, and in another 2 or 3 months, we could have candidates that are ready to give to the people. Whether they get to the people, of course, within what period, that's another story. But I welcome that speed. I think it's very good. And if we get a vaccine, then we could achieve herd immunity. But if we don't, we shouldn't expect that herd immunity is our solution, because getting herd immunity through infection is going to be it will cause us a lot of deaths, which is not good.
All right. Senator Matangi, let me bring you in on this. Now that we are mulling a possible inter-county lockdown, what then should be put in place before we even talk about that? Because then if you're going to lock down a specific county, you have to have put in place some measures there to take care of the people in there, to ensure that they can handle the rate of infections there. The human resource for the medics should be in place. Should we even be thinking about it right now?
Trevor, first, as a way forward, we must appreciate the uniqueness of our situation as a country, as a society. If you compare the Kenyan community with our other East African counterparts, you'll find that we have a lot of unique factors that should caution us to be much more careful. If you look at our population, maybe say for Tanzania, we are one of the most densely populated country around here. 2, look at our ratio of urban migration and urban habitation. Most of our people now have moved to urban centers. And given, for example, even the effect of devolution themselves, you find earlier on in counties where people are largely rural, because of the developments around centers and so on, even the counties themselves are having to deal with migration to the urban centers. And so because of that highly sociable life, we need to appreciate the fact that the rates of infection are much more likely to be higher at any one time than many of our comparative countries. And I say this because it would be very dangerous if we presumed in our own case that either we can compare ourselves with what's happening in Uganda, what's happening in Rwanda and other places, in Tanzania, we do not know. But that false sense of security that we would say that we are now better off, or we are feeling like we are making positive strides, I think it would be very, very ill-advised. Our best way forward, in my view, is to take high top caution as we strategize on the way forward. I would not think that per se locking down counties from either activities that are necessary and so on would be an ultimate solution. We are able to have, if you have mobility within a county, What protective measure does a boundary, which is not marked by a stone wall? What measure does it prevent you from doing? The idea here is that we will have to ensure that across the country we all take responsibility, and this must start from us political leaders across the entire divide. All of us. I mean, we have acted irresponsibly. That's the ultimate, judgment. And we have misled our people, and showed them bad examples, such that all of us must ensure that we correct this. Lastly, what I would be saying about the question you've asked directly on the inter-county functions, it is imperative that we maintain a certain level of socio-economic activities that would let life continue. But we must also say to our people that these are not ordinary times. It's such that if you are opening your hotel at this time, or you are carrying your burgers from this county to the other one and going and distributing them to every home, or whatever nature of activities, you must realize that during this time, it cannot be business as usual. And once people get to appreciate that, we up our level of enforcement to ensure that people can see that indeed when you do wrong, you are punished for doing that wrong, or there is a consequence for doing that. Then you realize that will become a deterrent. So in total, what I'm saying is that we have to be decisive, we have to be focused as a country. It must start from the top, then it will seep downwards. Educate our people right now. Let them know. You asked a very good question earlier, Trevor, to Dr. Are we able to tell Kenyans, is this a new strain that we are looking at? Remember, Trevor, when we first faced the HIV scourge, our medical experts, and especially after the research they were doing, even here in Cambridge, locally, they give us a very good information, very good chronology of how this virus first came at some of our people. It mutated into a stronger strain. If you take drugs, if you skip the drugs or you go into a break, you might get a harder strain that will be hard to, and so on. So I think some of this, and I would want to urge, while appreciating what our medical experts have done in institutions like Cambridge, but I think we have to do much more. Remember, Trevor, in all our universities in Kenya, one of the most ignored and underfunded, underutilized section is the research department. Yeah. Which of our universities carries out research, Trevor? Go to the University of Nairobi. Some of the most renowned institutions here, you'll find that research is a dead department in most of those universities. And look at countries like the USA, like the UK. Solutions to medical pandemics like these ones come from universities, and that's why you would be saying that if also we have lessons to under the country, is we have now to learn to be self-sufficient. Yeah. We have made a few strides by starting to make masks, but if the standard measure of how far we have gone is that we are now able to make our own masks. Trevor, we would be singing the song that I am 1,000, 2,000, 10,000 miles away from destination. Because at this time, we should be able to have, if I could just give a quick example, on Friday night, I was trying to assist a good friend of mine, actually a parliamentarian, who has got connections, if you like. His brother was brought to Nairobi late at night at about 10 p.m., suffering from COVID, unable to breathe. Went around the entire city, from private to public hospitals, looking for a bed. Finally, he found one bed at around 4 a.m. in a remote hospital where that bed had just been vacated about an hour before. And the amounts you hear that are being paid, humongous, 300,000 to occupy that one bed. So you'll be asking yourself, for goodness sake, then what will happen to that ordinary Kenyan in Gikomba? When they get in, what will happen to that ordinary Kenyan in Masako or in Thika town? And so I think this is what we are facing. We have to tell our people, you can't take this lightly. You can't take this lightly. You must act differently.
Yeah.
And we lead by example. We have to role model the way ourselves as leaders.
Let me bring in Governor Mutua on this as we close on this discussion. Yes. Where do we go from here now?
I think there are three issues here that are key as we conclude. The first one is it's very, very clear that our health resources are getting stretched and will get stretched. We have done a lot as counties. Regardless of what you hear about monies will be investigated, some of us have done very well. We have nearly 600 isolation beds, 35 ICU beds and everything. Our problem is the capacity in terms of our health workers. We don't have enough money to pay our health workers, but we've done quite a bit. And I'll come to that. Dr. Masika talked about the vaccine. It's good for me to inform you that Kenya is one of the countries that is also trying out a vaccine. And our policy in this country has been, we are not guinea pigs. So you try a vaccine in your country and also in our country, because vaccines work differently. What may work for a Caucasian may not work for a black person, an African. So it's good for us to also be places where vaccines can be tested, because once if you get a vaccine that works for Kenya, it means that we have that global connection to get vaccines to come to Kenya first, even before they go to some of our neighboring countries who are not participating into this. Number two, it's an issue of money also. I'm very happy that we've got this new BBI that is adding 35% to counties. That means we'll have more money to do more in healthcare. Counties have revolutionized healthcare across the board. We've bought ambulances, we've hired more health workers, we've improved hospitals and healthcare. When we get this more money coming in, if the BBI passes, when it passes, it means that we'll be in a better place in terms of being able to take the country forward. And lastly, issues of leadership. We must ask ourselves, why are we in this situation now? Why aren't we funding our researchers? Why don't we have money? It all comes down to the economy and money. We need to focus ourselves. I'm running a presidential campaign based on the economy, because at the end of the day, it's all about the economy. And let me be blunt here, Trevor, if you allow me. You know, we have to take responsibility as leaders. If I am on the steering wheel and my job is to ensure that we put chlorine in drinking water so that people don't get cholera, and I'm busy playing other things, going around running campaigns, and I don't put chlorine, and then people get cholera, and then I rise up and I go to the people putting cholera and I say, I am one of you, sisi wote tuna cholera pamoja, sisi tuniunge mkono, tutaondoa hii cholera, sisi wote tutaform serikali ya watu wako na cholera, na mimi ndio sikuweka dawa ndio umepata cholera. Then we are being, it's a kind of mind games that Kenyans are being exposed to. Yeah. We need to know that leadership is about growing the economy. Yeah. Leadership is about more money to the pockets. That's why we need a fresh start in this country with maybe a leader like myself who understands the importance of research, because I've got, academia experience, having taught in universities and all that. Okay. Once we have the money, we can do the research, we can do the productions that are being talked about, we can do lockdowns. Yeah. For example, in Australia, people, when they're told to go in lockdown, everybody goes home, including the police. Even the police lock themselves down. Why? Because the government is giving you 100,000 shillings a month as a family unit to cushion you. How much are we getting in our country? You can't have lockdown in our country. People will starve to death. So we need to grow the economy. It's about money, Trevor, at the end of the day. Okay. Even these COVID cases rising, people going out, matatus and everything, it's about money. And we need leadership that understands money. All right.
Dr. Masika, you're being the expert on this now. So where do we go from here? And is this virus likely to mutate again? What happens now?
Yes, as I address your issues, I would like to talk to two issues that have been raised by my senior brothers. One is Senator Matangi's research issue. Yeah. I dedicate more than half of my time at the university to do research. Most of our funding comes from external donors. Our laws, the Science, Technology and Innovation Act, I think passed about 5 years ago, says we should have 2% of GDP going to research. Please give us this money, we will give you results. There is no research without funding at all. The second thing is about the governor's issue about healthcare workers and funding for healthcare in the counties. I think the counties have done a good job, but as you say, healthcare workers are not enough. Let's find the money somehow to hire these healthcare workers, because we know they are unemployed. Many unemployed healthcare workers sitting around in the country doing other things that are of little service to the healthcare system. And we will need them, because we are now pushing for universal healthcare, not just for COVID. And I think that's a challenge I want to throw to my brothers and all Kenyans in general. Let us not say we cannot hire healthcare workers because we don't have money. We can see the kind of amounts we are spending doing other things. We just need to prioritize healthcare. And also, you gave an example of somebody putting chlorine in water and then putting something else. I think we need to improve our accountability system so that if somebody is supposed to put chlorine, somebody else comes and check that they actually did it. And if they didn't, then they take the responsibility and get punished for it. And to my Kenyans, I think, my fellow Kenyans, from the top politicians to those who are not in power, we need to realize that we have to protect ourselves and protect others. As we say, many people with COVID are asymptomatic. So you will not know if the person you're talking to, laughing with, singing with is positive. You do not know if you're positive yourself if you're not showing any symptoms. So the things that we must follow are social distancing. Do not leave the house unless you have to. If you can work from home, please do so. And each boss or each manager should be challenged to put as many people to work at home as possible and facilitate that. We can invest in IT to make it work. Now, for the virus itself, we know viruses mutate, and this virus is mutating every day. But that is not necessarily what makes the virus worse. We see viral mutations. Some of them make the virus weaker. Some of them makes the virus spread easier. Others makes it cause severe disease. But as we study that, the biggest challenge right now is stopping spread. And if we do not follow the simple measures, whether the virus mutates or not, it will spread. So we need to look at that and ensure that we take the measures required to prevent spread. I think I've answered all your questions, Trevor.
Yeah, thank you.
Yeah.
I think we are good now.
For your time.
And we have to leave it at that point. Thank you so much, Dr. Moses Masika, a virologist there and researcher at the University of Nairobi, Kimani Wamatangi, Kiambu Senator, and Dr. Alfred Mutua, Machakos Governor. Thank you so much for speaking to us.
Trevor, as you go, I thought it would have been good if we had a go at what you said about the USA, because looks like they are learning first from us about dashing to the Supreme Court when elections are contested and urging stoppage of counting votes. I mean, because Dr. Alfred has said that he's a presidential candidate, and I congratulate him and wish him well in his campaign. And please don't start campaigning now. Let's first deal with COVID. There's been enough time to campaign. But I really wish you well. Yeah. Just in case you ever get to the point where the US is, don't go to the Supreme Court. Admit.
Let's wait and see how the US election turns out. That's why I didn't bring it up now.
My message to Mutua and other aspirants would be to campaign safely.
In my other years,
yes, we will.
I would be asking you that in case you need a running mate, then you can come to Kiambu and find me. Anyway, I wish you well, man.
All right, guys, thank you so much.
Tunasema mambo ni fresh na Mutua. We want, the thing about the US is that regardless of who wins in the US, there's going to be electricity in every house, as usual. There's going to be water in every house. The roads are still paved. Life continues. People are still working. Yes, things may change a little bit, but the general welfare of the people of the US is okay. Airports will be open, industries will be. It doesn't change as much as it does in our country. So here we need a fresh leader who will bring us to the US area of economic freedom. So it doesn't matter who is president or who is prime minister or who is what. All right, guys, I have to leave it there. Thank you so much for speaking to us. We'll see how the US election turns out, and then we'll talk about it at the time when the results are out. All right, but we are taking a quick break here on Daybreak. We're back with much more in just a bit. I'll be speaking to the Commissioner General for the Kenya Revenue Authority, Mr. Gidhi Mburu, to find out at this particular point, with the pandemic, how the tax is going. That coming up in just a bit. If you have any questions, tweet at Citizen TV Kenya, at Trevor Mbija, #Daybreak. See you in a bit.